The United Nations Millennium Development Goals (MDGs) are 8 goals that UN member states have agreed to try to achieve by the year 2015. The United Nations Millennium Declaration, signed in September 2000, commits world leaders to combat poverty, hunger, disease, illiteracy, environmental degradation, and discrimination against women. The MDGs are derived from this declaration. Each MDG has targets set for 2015 and indicators to monitor progress from 1990 levels, several of these related to health. Progress Report or the Health-Related MDGs. While some countries have made impressive gains in achieving health-related targets, others are falling behind. Often, the countries making the least progress are those affected by high levels of HIV, AIDS, economic hardships, or conflict.
Good day everyone. So for today's news is all about the United Nations Millennium Development Goal, and I'm your host, MATILDE. Millennium Development Goal number 1 is to eradicate extreme poverty and hunger. Target 1.c half between 1990 and 2015 the proportion of people who suffer from hunger. Undernutrition, which includes fatal growth restriction, stunting, wasting, and deficiencies of vitamin A and zinc, along with suboptimal breastfeeding, is the underlying cause of death in an estimated 45% of all deaths among children under 5 years of age. So the proportion of underweight children in developing countries has declined from 28% to 17% between 1990 and 2013. This rate of progress is close to the rate required to meet the MDG target. However, improvements have been unevenly distributed between and within different regions.
Millennium Development Goal 2: Achieving universal primary education for boys and girls. The fact that rural children are highly affected by hunger and malnutrition has also seriously affected their learning ability. As such, food security and primary education should be addressed at the same time to give rural people the capacity to feed themselves and overcome hunger, poverty, and illiteracy.
Millennium Development Goal number 3 is to promote gender equality in all levels of education and empower women. It is important to promote the total and equitable participation of both men and women in efforts aimed at improving poverty reduction, food security, and sustainability of rural development. Without gender equality and the economic and social improvement for rural women, food security cannot be achieved. Some of the achievements of MDG 3 includes: in Southern Asia, the number of girls enrolled in primary school was 74 for every 100 boys in 1990. By 2015, there were 103 girls enrolled for every 100 boys. So the last one is the proportion of women in vulnerable employment compared to total female employment has reduced by 13% in the period between 1991 and 2015, compared to a 9% decrease for women.
Hi everyone, I am CRIS DAYATA from BCAED 1B, discussing the Millennium Development Goal number 4. Millennium Development Goal number 4: Reduce child mortality. Target 4A: reduce by 2/3 between 1990 and 2015 the under 5 mortality rate. Globally, significant progress has been made in reducing mortality in children under 5 years of age. In 2013, 6.3 million children under 5 died, compared with 12.7 million in 1990. Between 1990 to 2013, under 5 mortality declined by 49% from an estimated rate of 90 deaths per 1,000 live births. The global rate of decline has also accelerated in recent years from 1.2% per annum during 1990 to 1995 to 4% during 2005 to 2013. Despite this improvement, the world is unlikely to achieve the MDG target by 2/3 reduction in 1990 mortality levels by the year of 2015. More countries are now high levels of immunization coverage. In 2013, 66% of member states reached at least 90% coverage. In 2013, global measles immunization coverage was 84% among children aged 12 to 23 months. During 2000 to 2013, estimated measles death decreased by 74% from 481,000 to 124,000.
Millennium Development Goal 5, Improve Material Health Target 5A, reduced by the 3 quarters between 1990 and 2015. The material mortality ratio. Target 5B, achieved by 2015 universal access to reproductive health, despite a significant reduction in the number of material deaths from an estimated 523,000 in 1990 to 289,000 in 2013. The rate of decline is less than half of what is needed to achieve the MDG target of a 3 quarters reduction in the mortality between 1990 and 2015. To reduce the number of material deaths, women need access to good quality reproductive health care and effective interventions. In 2012, 64% of women aged 15 to 49 years who were married or in a consensual union were using some form of contraception, while 12% wanted to stop or postpone child learning but were not using contraception. The proportion of women receiving antenatal care at least once during pregnancy was about 83% for the period 2007 to 2014, but for the recommended minimum of 4 or more visits, the corresponding figure drops to around 64%. The proportion of births attended by skilled personnel crucial for reducing perinatal, neonatal, and material deaths as about 90% in 3 of the 6 WHO regions. However, increased coverage is needed in certain regions such as the WHO African region, whose the figure was still only 54%.
The Millennium Development Goal number 6 is to combat HIV or AIDS, malaria, and other diseases. We have Target 6A, 6B, and 6C. For Target 6A is to have halted by 2015 and begun to reverse the spread of HIV or AIDS. For Target 6B, achieved by 2010 the universal access to treatment for HIV or AIDS for all those who need it. In 2013, an estimated 2.1 million people were newly infected with HIV, down from 3.4 million in 2001. By the end of 2013, about 12.9 million people were receiving antiretroviral therapy or ART globally. Of these, 11.7 million people lived in low and middle income countries, representing 36% of the estimated 32.6 million people living with HIV in these countries. Should current trends continue, the target of placing 15 million people on ART by 2015 will be exceeded. The decrease in the number of those newly infected, along with the increased availability of ART, have contributed to a major decline in HIV mortality levels. From 2.4 million people in 2005 to an estimated 1.5 million in 2013. As fewer people die from AIDS-related causes, the number of people living with HIV is likely to continue to grow. Target 6C have halted by 2015 and begun to reverse the incidence of malaria and other major diseases. About half the world's population is at risk of malaria, and an estimated 198 million cases in 2013 led to approximately 584,000 deaths, most of these in children under the age of 5 living in Africa. During the period 2000 to 2013, malaria incidence and mortality rates of population at risk have both fallen globally, 30% and 47% respectively. The coverage of interventions such as the distribution of insecticide-treated nets and indoor residual spraying has greatly increased and will need to be sustained in order to prevent the resurgence of disease and deaths caused by malaria. Globally, the MDG target of halting by 2015 and beginning to reverse the incidence of malaria has already been met.
Tuberculosis. The annual global number of new cases of tuberculosis has been slowly falling for a decade, thus achieving MDG target 6.C to reverse the spread of the disease by 2015. In 2013, there were an estimated 9 million new cases and 1.5 million deaths, including 360,000 deaths among HIV-positive people. Globally, treatment success rates have been sustained at high levels since 2007, at or above the target of 85%. However, multi-drug-resistant tuberculosis, MDR-TB, which emerged primarily as a result of inadequate treatment, continues to pose problems. Other diseases. MDG target 6.C also includes neglected tropical diseases, a medically diverse group of infectious conditions caused by a variety of pathogens. In 2013, only 6,314 cases of human African trypanosomiasis were reported, representing the lowest levels of recorded cases in 50 years. This disease is now targeted for elimination as a public health problem by 2020. Draconiculiasis is also on the verge of eradication with an historic low of 126 cases reported in 2014 and an ongoing WHO target of interrupting its transmission by the end of 2015. Plans to eliminate leprosy as a public health problem worldwide by 2020 have been also prepared and being implemented. The elimination of visceral leishmaniasis as a public health problem in the Indian subcontinent by 2020 is on track with a greater than 75% reduction in incident cases recorded since the launch of the program in 2005. In the case of lymphatic filariasis, more than 5 billion treatments have been delivered since 2000 to stop its spread, and of that 70 known endemic countries, 39 are on track to achieve its elimination as a public health problem by 2020.
Millennium Development Goal number 7 is to ensure environmental sustainability. Target 7.C by 2015, half the proportion of people without sustainable access to safe drinking water and basic sanitation. The world has now met the NDG target relating to access to safe drinking water. In 2012, 90% of the population used an improved source of drinking water compared with 76% in 1990. Progress has, however, been uneven across different regions, between urban and rural areas, and between rich and poor. With regards to basic sanitation, current rates of progress are too slow for the NDG target to be met globally. In 2012, 2.5 billion people did not have access to improved sanitation facilities, with 1 billion people are still practicing open defecation. The number of people living in urban areas without access to improved sanitation is increasing because of rapid growth in the size of urban population.
Millennium Development Goal 8. Develop a global partnership for development. Target 8E. In cooperation with pharmaceutical companies, provide access to affordable essential medicines in developing countries. Many people continue to face a scarcity of medicines in the public sector, forcing them to the private sector, where prices can be substantially higher. Surveys undertaken from 2007 to 2013 show the average availability of selected generic medicines in 21 low and middle income countries was an estimated of 55% in the public sector. Even the lowest priced generics can put common treatments beyond the reach of low-income households in developing countries. The greatest price is paid by patients suffering chronic diseases. Effective treatments for the majority of the global chronic disease burden exists, yet universal access remains out of reach. This is Albrando reporting.